Hello, welcome to our DDM farm channel. My name is Mark Eyangu. Please subscribe and hit the like button below. So today is our tennis day, meaning our birds have finished 1 week and 3 days, and literally we can see how they have grown, and we can differentiate between the cockerel and the pullet. A cockerel is a male chick, and as you can see, it's this one, and a pullet is a female chick. So for the differentiation case, the pullet has developed the tail feathers fully, or let's say partially. It has developed the tail feathers, while the cockerel hasn't yet developed, but just a little, and it's big in size compared to this one as well. But so sometimes it's complicated in terms of sizes, because you might find a pullet is bigger than the cockerel. So for that case, we are looking at the tail feathers as well, you can see, and they are very healthy in the tennis day. However, today we are going to talk about some of the common poultry diseases. So first and foremost, we have the infectious bronchitis. Infectious bronchitis is one of the contagious diseases which affects the poultry birds. So infectious bronchitis is got from the contaminated feeds, the water given to the birds, and it's one of the deadly diseases which you can see the signs from coughing, since it's a disease which affects the respiratory system of the birds. So, and it causes the decrease in the egg production on the side of the mature birds, so which really results into the loss to the farmer. So the other, it will really lead to the increased mortality of the chicks. Where do we get it from? How does it transmit to our chicks? So it's an airborne disease, meaning it can be got through air breathing, as when you see them in the brooder house like this. Since there is that air circulation, maybe it is slow, but since there is a ventilation, a good and a proper ventilation, it protects, it helps in that. The other is direct contact with the infected birds or chicks. So through body contact, the disease can be transmitted to other healthy birds. And to that, as I'd already told you, that it's contaminated contaminated water and the feeds which will be given to the birds, and that is how it can also be transmitted to the birds. Now, prevention method, how can we really prevent the infectious bronchitis? So infectious bronchitis, it is a disease always affecting the young chicks. Now, it can be prevented through vaccination of our chicks. So we vaccinate them against the disease. This could be the active, using the active vaccine or the live vaccine to prevent it. And we have the biosecurity measures, like culling them. We get the sick birds and put them in the sick bed for continuous monitoring, and as well maintain good ventilation in your poultry or in the brooder house. Meanwhile, there is another disease called the Newcastle disease or NCD, caused by the paraxmus virus, and this is one of the deadly diseases that needs prior attention before it affects our birds. So you must vaccinate your birds before they fall sick. Once your birds, it is one of the diseases which can kill the entire flock in the poultry farm. And once you vaccinate the birds once and they were sick, they will all die. So you have to be keen and monitoring your birds, looking on their health to know how they are performing. In case of signs that shows you that of an attack from Newcastle, you need to cull that bird. But what are the symptoms of the Newcastle disease? So Newcastle disease, you find that the birds, oh, your chicks has the respiratory issues. The respiratory issues, one of them is like coughing, sneezing, and then gasping. So because this the Newcastle disease affects the nervous system and the immune system, and you find that there is a decreased egg production as well, increased mortality rate in the birds. So how does it transmit? Since our flock are together, there is direct contact with the infected infected birds. So you find that once the healthy birds get in touch with the sick ones, they can contract the virus. And the other is also from the feeds or the droppings in the house, in the poultry bird house. Once they maybe take a taste of it, they eat, they can contract the disease. Newcastle disease is also one of the airborne diseases which really affects the poultry birds, and finally at the end of it, it leads to a loss to the farmer. So what are really the prevention and the control measures to this disease called the Newcastle, which is caused by the paraxmus virus? The first prior prevention is the vaccination. So vaccination of the chicks before the attack or following the vaccination schedule or the vaccination calendar as given by the distributor farm must be followed. Secondly, the biosecurity measures like the quarantine or culling of the sick birds from the healthy flock to the sick bed. And also there must be good ventilation to allow the free air circulation into the poultry house, and also this helps to take away the bad odors, ammonium gas as well, which would cause the disease to the birds. But there is no specific treatment as per now, but supportive care must be given to help the birds, and also use the antibiotics as the secondary bacterial infection control to help the birds or to boost up their immunity. And the other disease that we have is the gomboro, which is the infectious basal disease. So the infectious basal disease is caused by the rhinovirus, which affects the bird. And what are the signs? The signs, we have the diarrhea and dehydration in your birds, loss of appetite. So you have to check on the appetite of your birds, and as well the droppings. So once you see there is diarrhea, it must be the one, and as well leads to dehydration in our birds or in our flock. So what are the control measures? Control measures. First and foremost, you must vaccinate your birds. Remember following the vaccination calendar provided by the supplier of your chicks. You must follow that. And the other, remember to follow the biosecurity measures which are required in the farm, which are required in the brooder house, to control or to curb all these diseases. Now, something little that I'd forgotten about: how is the infectious basal disease transmitted? Body contact. So once the healthier birds get in contact with the affected birds, there is a high possibility that the birds shall contract the disease. Secondly, ensure that your feeds are not contaminated as well the water, because our birds can contact or get gomboro from the contaminated feeds and the contaminated water.